Welcome back. Right now I have the honor of speaking with Dr. Alejandro Badia. He is the author of the book, Healthcare from the Trenches. He is a renowned surgeon. Dr. Badia, thanks for joining us today.
Thank you. Thanks for having me.
So I'd love to just start with your background. What made you decide to become a surgeon?
Wow. Well, in chapter 1 of my book, I talk about how there was a long lineage of surgeons and physicians in general in Cuba. And then when we emigrated to the U.S., I was a baby. I was very inspired by my grandmother who suffered from rheumatoid arthritis. And then I went to see a hand surgeon, interestingly enough, in New York, and that stuck in my head. But I was always really pursuing a career in medicine. It was pretty clear to me as a child.
Did you ever consider any other type of medicine, or was it always surgery?
I did some research in cardiology, so there was a time when I was certainly open to other, but it was, for some reason, I was drawn to surgical discipline from early on.
And tell me a little bit about some of your experiences as a surgeon throughout your career.
Wow. Well, it's interesting now with COVID. I was a surgical resident at Bellevue Hospital, big public hospital in New York City, in Manhattan. And I was there when the AIDS epidemic broke out. And we didn't really quite understand it. One thing very different from COVID is at that time, unfortunately, it was almost a death sentence. We didn't have the retrovirals and therapies that we have now. So I remember, many times being in the OR with literally my arm up to my elbow in somebody's abdomen, not knowing, or sometimes knowing they were HIV positive, and we didn't know what that meant. So certainly I have a different perspective of COVID, but I did my surgical training was mostly in New York. Then I was in Pittsburgh, and throughout the years I've had a number of different cases that just stand out in my mind, and I do discuss those in a book because I think the idea is to explain to people what we really do. I think we've kind of lost that with the media. Fortunately now, with the current pandemic, I think people are appreciating physicians a lot more. But the idea of the book is to really get the reader to understand the long journey, the process of becoming a trained surgeon. And then the challenges that we're up against now, which is in the second section of the book.
Is there any particular case that really motivated you or really led to you writing the book?
There is I go through this every Monday where what motivated me to write the book is the incredible frustration of delivering care. I think patients realize that when they want to see a particular type of physician, they have to jump through hoops. But imagine being on the other end, trying to deliver the care and having all these hurdles, all this bureaucracy. And it's gotten to the point where the insurance companies almost practice medicine. And I thought it was time that people understood, from the trenches, not from a Tony Fauci or a Sanjay Gupta, but from somebody who is seeing patients every day. And I illustrate several cases, but certainly one really interesting case where it was somebody I sort of knew because she works at a restaurant and my father frequents, and she had a shoulder injury. Now, she didn't put two and two together that she knew me and I happened to be a shoulder surgeon, but the system. And when I say the system, it was a work comp injury. She slipped at the restaurant she worked at and hurt her shoulder quite severely. And it took a year for her to get to me, meaning the system had her seeing kind of general clinics. And even when I saw her, there were hurdles for me to be able to recommend the necessary treatment. And her name is in the book. In fact, some of the people from the insurance company's name is in the book because it was time to just tell the story. And that's what we tried to do. And it's not just myself. There are 27 contributors in the book, everywhere from physical and occupational therapists to nurses. Even a big hospital executive gives their perspective.
And you lay out quite a few recommendations on what you think should change within healthcare. Maybe share one or two of those.
Sure. I think the most important one would be go back to health insurance companies being non-for-profit, meaning they don't answer to shareholders, to investors. It should be about delivering the care, and certainly they can be competitive. I'm very much, being from Cuba, I'm very much a capitalist, and I believe in the free market. And the insurance companies can, if they're successful, certainly they can pay their executives very well, as they deserve to be. But I don't think that they should be trying to gain profits, because the profits should be reinvested back into actual health care, whereas denying care and rationing health care is what often happens, so that they take our premiums, they dole out the care, and at the end there's a pretty hefty profit. If you looked at what they are now in the first quarter because of COVID, I mean, it's in the billions because people are afraid to seek care. And really that money should be going into helping the less fortunate. And that's why I'm against, many physicians were against the whole concept of the ACA and Obamacare, is that our system should be able to take care of those who need care. And we have enough money in the system to do it, rather than forcing more bureaucracy on us. So I think that is one step that we can do. Another one is the transparency. I think that people need to understand what healthcare costs, and then we could be truly competitive, like everything else in a free market economy. And there's a book by Julio Gonzalez. Actually, I happen to have it because I was looking something up. I was writing a review actually on his book. He wrote the foreword, and Julio Gonzalez is an orthopedic surgeon, and basically he's making a case that there should be a free market component which will help control the costs.
And of course, we have to bring up COVID. In relation to this book that you wrote, what has changed because of this pandemic?
Well, certainly I think it's exposed so many inefficiencies and flaws in the system. And I don't want to get into a lot of detail of that, but let's talk maybe about some of the positive. The positive can be that people finally are engaging in something that technology is allowed. And we're doing that right now with this interview. I've been doing telehealth for about 6-7 years, mostly with my international patients. About 30, being in Miami, and I'm bilingual, 30% of my practice are people who come from other parts, mostly of this hemisphere. And I'll see some from Europe as well, occasionally even Asia. And I'm able to interview that patient, do a rough physical exam without laying my hand on them, and come up with a treatment plan all remotely. And I think it's high time that healthcare really took advantage of that, and because that represents a cost saving and increase in efficiency. So COVID has certainly almost forced our hand with that, and I think that is a good thing.
And tell me about what you're doing now. What practice are you in, and what are you working on primarily with your surgery?
Sure. So definitely volume is down. Patients, unless they're really in a lot of pain, are putting off care. I discussed this with my colleagues, and it seems to be the case. In my case, I do from the really fingertips to the shoulder. So on Tuesday, I have, I don't know, two rotator cuff repairs, a labral repair. I just got through the app, I just got a notification about a bad fracture in a 90-year-old. And so I'll be adding that on. So I'm taking care of people. Obviously, we're all practicing, social distancing. We wear a mask. We're washing our hands frequently. But in the end, we are a business of necessity, right? That healthcare. So that hasn't changed much. The other thing we're doing is I'm the co-founder of Ortho Now, which by the way, we had a lot of interest in putting them in the mountains and ski slopes. Because if you think about when somebody gets hurt, they kind of go to this general center, unless it's really severe. If it's very severe, they go to a hospital with, say, a tibia fracture. But we are seeing in the Miami area, in our 3 Ortho Now centers, patients walk in with an orthopedic problem. It can even be quite a severe injury, and we can see them without them being exposed to the virus that you'll see in a big hospital system. So we're quite busy with that.
And Dr. Badia, where can we find more information about you, your research, and your book?
Sure. So my website's drbadia.com. That's just Badia, Badia.com. And then the book, you can find it on my website, or you can do drbadiabook.com. And then obviously you can just search the name of the book, Healthcare from the Trenches, on Amazon. And we're getting a ton of reviews. I've been, I guess maybe because it's an election year or during the pandemic, but there is a huge amount of interest. Is people realize that our healthcare should not be almost 20% of our GDP. The next country in line, the second in line is Norway, which spends a lot of money on healthcare. I've actually done surgery in Norway, in a fishing village. Excellent healthcare, and they spend about 10.3%. So we're almost double what the next industrialized country that has a lot of parallels with us. So we definitely need to understand what the challenges are before we can go ahead and fix it.
Well, Dr. Badia, it's been a pleasure talking with you today. We thank you for joining us and spending some time with us here on Park City Television.